Framing Eye Care podcast. I'm your host, Dr. Maria Sampoulos. Today we have Dr. Richard Edlow with us. He is very well known in our industry, has been on the podcast before, and got the listeners to ask for more and get some more information from Dr. Edlow. So thank you for joining the podcast today.
My pleasure. Looking forward to it.
Yeah, you have a lot of information. I mean, you've written and lectured on eye economics in the past, been on the chair for AOA, for Information Data Committee, and a lot of other things as well. So known as an expert in the industry on different eye care topics and economics. Just give us some information. How large is the eye care industry?
It's a very significant industry in the U.S. and in healthcare in general. When you think about it, we're over $118 billion of an industry. And to put that in perspective, there are other, like, for example, the National Football League is maybe $16 billion a year. We're $118 billion. And that includes really the three O's, the three silos of eye care. So it's optical, everything included in optical. It's everything included in optometry, everything included in ophthalmology. So it's vision care services and it's medical eye care services. And when I discuss the whole economics of eye care, we always look at vision and medical. And when I use the term vision throughout this discussion, I'm referring to a diagnosis that is a refractive diagnosis. So it's myopia, hyperopia, astigmatism, presbyopia. Anything that goes into that category with that diagnosis is considered vision care. Routine eye exams, eyeglasses, contact lenses, plano sunglasses. And then everything that has a medical diagnosis, that has an ICD-10 code that Medicare would pay for example, is considered medical eye care. And when we look at that $118 billion, approximately in today's number, approximately 35% of that is medical eye care and 65% vision care. So a huge amount of it is still in routine vision care services. In that vision care, or in that total $118 billion, about 52% of it is strictly optical, eyeglasses, contact lenses. So when we look at how this whole eye care industry looks, still a very large portion is optical and is vision care. But the messaging is that this is all shifting. It's shifting dramatically into more and more medical eye care services.
Yeah, and I think that's the opportunity for a lot of optometrists should see, that there is big opportunity in medical in your practices. If the pie is only 35%, think about the opportunity you have to build that, especially with AOA scope changes and things like that, and all those battles that we fight now to get better scope. There is opportunities for that growth mindset OD to really find an opportunity to grow in the next 10, 20, 30 years.
The messaging from that perspective is that if we look at going forward, if I'm an optometrist, regardless of what setting I'm in, or whether I'm in a corporate setting, a private optometric setting, an ophthalmology, optometry, vertically integrated setting, regardless of what setting I'm in, if I want to look beyond today, look over the horizon to see where the opportunities are, it's in the growth of medical eye care services. So it's how do I position my practice to increase diagnostic capabilities? How do I increase my practice to improve the patient flow so that I can continue to handle all the refractive eye care services I need to provide, and at the same time be able to add on more and more medical eye care services? And so think about this. Some of the statistics are, when we look at the current decade that we're living in now, 2020 to 2030, the U.S. population that is 65 and older is growing 30% over this decade, 30%. It's a huge number. And as we all know, age-related eye care services, cataracts, glaucoma, macular degeneration, dry eye, whatever it may be, the U.S. population, 65 and older, Medicare, is growing 30%. Yet the growth in ophthalmology ophthalmologists out there in the workforce, instead of is not growing at 30%, it's growing at 3.4%. So who are you going to call? There's an inequity there. Ophthalmology cannot provide services, the increased demand for age-related eye care that is falling upon the entire public health network. Optometry's got to do it. With ophthalmology, there's a limited amount of residency spots. There's a certain amount of retirement and exiting from the profession each year. And it nets out that we have about 60 new ophthalmologists in the entire country each year.
60?
60. And
Wow.
5 are going to go to California, 5 are going to go to Texas, 5 are going to go to New York, and probably 10 to Florida. So that's 20. That leaves 35 new ophthalmologists for the entire country. When
one for
the
each state.
when the demand for medical eye care services is growing at 30% over this decade. There was a study that just came out recently that how long does it take to make an appointment with a specialist in the U.S.? And think about to make an appointment with an ophthalmologist. It's 26 days. So if you have an eye care problem and you call around and it's 26 days, and ophthalmology has probably been worse than 26 days. Optometry needs to fill that void. It's incumbent upon optometry as a profession, again, regardless of what setting, it's incumbent upon us to make sure that we improve our patient flow, that we use technical staff to help flow through the practice so that we can provide all that care. Again, I'm a numbers geek. I track all this stuff. I use Medicare data, census data, all types of extrapolation of data, put it all together. And one of the messages is by 2030, as a profession, optometry and ophthalmology, we need to deliver an additional 15 million medical eye exams each and every year, 15 million. Now that's with 60 new ophthalmologists in the entire country each year. We need to deliver 15 million. So optometry needs to fill that void. And optometry, Maria, as you mentioned, with scope of practice that the AOA has been successful at across the country, optometry is very well positioned to deliver that care. And that 15 million increase in medical eye exams does not include surgery, does not include the diagnostic testing. It's 11 million more diagnostic tests we need to provide each year, every year. So when you add all that up, there has never been a better time to be an optometrist in the U.S. The opportunities abound us, but the message is get ready, be prepared for it, increase your efficiency in your practice.
Yeah, be comfortable. There's a lot of resources out there. Doctors that feel uncomfortable with the medical model. There's a lot of education. There's a lot that, and then there's also, the technology has changed. It's, I'm a big believer in technology in my practices. Really can be efficient, educate the patient with the technology, and have better outcomes for the patient. So those are how I've equipped my practices with technology, and a lot of doctors have as well. But I saw an opportunity to grow, and I have multiple practices. One of the practices is really a geriatric practice, and it seems like every week it's like one day is all medical: glaucoma, central serous retinopathy, that are rare, Posner, Slandrum syndrome last couple of weeks ago. Things that you learn in school and haven't seen it in a while, and you know what? It's still saved up there. So it's the care is there that will differentiate the doctor in the area, right? And patients that have medical concerns, or you put on that drop for glaucoma or dry eye, they're loyal to your practice. They're not going anywhere else.
It's some of the stats show that only about 20% of revenue in a typical optometric practice is coming from medical. 20%. I expect that to increase to 35%. But again, at the same time, don't give up the optical. That's still a huge portion of an optometric practice revenue and profitability. But the medical is going to increase. And to your point about technology, uh, whether it's implementing some of the automated refractive technology that a technician can run and then be finalized by the OD in the exam room. Um, a lot of the diagnostic technology from retinal imaging to increase the rapidity of the patient flow, uh, making sure simple things just from a physical plant perspective of making sure per doc you have enough exam rooms for that patient flow to work through it because the demand in optometry is going to increase. I don't know if you recall 10 years ago, 5 years ago, whenever a new optometric program was opening around the country, there was all this, oh my God, we have too many optometrists. What are we doing? Well, there's a shortage of optometrists. We have about 1,800 new ODs a year, but we have over 1,200 exiting a year from retirement and disability, whatever. So that's a net increase of just 600 optometrists a year. And that's only an increase of 1.2% a year. 1.2% a year, whereas the demand for both the vision care services is tracking along at 1.5 to 2% a year, and medical much more rapidly, as I mentioned earlier. So there's never been a better time to practice optometry for the opportunities that are out there. And B, make sure you're ready for the onslaught of the increasing demand for medical eye care. The One of the proxies I use, I might be asked, how engaged is optometry in providing medical eye care? How do we know? Right? Unless you go around to every optometrist in the country and take a poll, there's no way of determining it. So as a proxy, I use Medicare data. So Medicare each year publishes the utilization of payment data. It shows what every single doctor in the country bills Medicare for: optometry, ophthalmology, podiatry, cardiovascular surgeons, neurosurgeons, every single doc. Every year I download all of the data for both ophthalmology and optometry. It's hundreds of thousands of rows of data. And in my mind, if I'm an optometrist and I'm providing any kind of medical eye care, so I'm not just doing routine refractions and glasses, but if I'm doing any medical eye care, I'm doing some diagnostic testing and I'm implementing some treatment protocol, whether it's just following the patient at 3 months or a year or instituting some therapeutic drop treatment, whatever it may be, I'm doing at least one diagnostic test. So, as a proxy, I look at the Medicare data and I look at all the optometrists in the United States and I look to see how many optometrists have done a visual field. Just one visual field. That's all it takes. If you've done one visual field, it tells me you've done something medically oriented. You have an increased CD ratio, and you want to just make sure the patient doesn't have any early glaucomatous changes, whatever it may be. The percent of all optometrists in the U.S. who perform a visual field is just 29.5%. So the bad news is only 29.5% of optometrists in the country are really doing any medical eye care. The good news is only 29.5% are only doing, so that leaves a whole population of optometrists to start performing, brush up on, like you said, it never leaves your head, brush up on diagnosing and treating medical eye care services because we're going to have to.
That's a crazy low number, which I was
Yeah,
surprised about.
I
That's
am too.
crazy low. I had gotten some data from the pharma that some pharma company said. They said only 10% prescribe drops. And we're talking about like Tobradex and like Restasis or that stuff, like the easy stuff, right? But only 4% are prescribing drops for glaucoma. And from that 4%, if it gets to be middle or advanced, they refer it out. So for me, I saw like it was an opportunity to really, because we have the knowledge, we have the education. It's just, some doctors might not feel comfortable or they're so busy and optical. But I mean, they have to see what the future holds. If you're a business owner, you have to see tomorrow, you have to have a game plan for 5 years, for 30 years. You
Yeah,
have to have a game plan.
yeah,
And this is some, like, for me, staggering data that 29% are only doing fields. And there's a lot of things you can do for fields besides just glaucoma suspect. There's a lot of things there. So it's surprising to me that they're not. And for all this work that a lot of optometrists are volunteering their time in with the AOA to advance our profession, to not take advantage of it, is that, and we might take some things for granted.
We've got a lot of work cut out.
We have a lot of work, and just the fact that we take for granted that we put drops in someone's eyes for dilation at this point. I think we kind of need a history lesson to show how far we've come and where we can really be in the future. What are some driving market forces that will affect optometry in the next 10 years?
Yeah, well, it's really, I hate to bring this one up. It's pretty timely to the discussion right now. The whole issue in Florida, you can't call yourself a doctor. It's ridiculous. But that whole concept has to just disappear. It's going to take a lot of hard work, but it has to disappear because the driving forces are the aging population, the age-related eye care. You can look at National Eye Institute data on prevalence of glaucoma, cataracts, and macular degeneration. And I can assure you that the workforce in ophthalmology is incapable of handling it in the future. So it's incumbent upon optometry to do so. So that's the increasing demographics of the aging population, my generation of the baby boomers. You're way too young for this, but the baby boomers. It's going to be dramatic. And probably one of my favorite points out of all that, when we think about the increasing demand for these services, is that cataract surgery in 2020 in the US, there were approximately 4.2 million cataract procedures performed. 4.2 million. In 2030, it's estimated that the profession, the eye care profession industry, needs to deliver 5.6 million cataract procedures. That's 4.2 to 5.6 million procedures from 2020 to 2030. Well, that's an increase of 1.4 million cataract surgeries. All right. And those numbers are conservative. I get estimates from Alcon and J&J that are much higher than that, but let's be conservative. 4.2 million to 5.6. So we as a eye care profession, ophthalmology, needs to deliver 1.2 million additional cataract procedures. The average ophthalmologist in the U.S. performs 400 procedures a year. Some do 50 or 100. Not many. A handful will do 3,000. But on average, across the board, 400 cataract procedures per year. So to deliver an extra 1.4 million procedures just in 1 year in 2030, that additional we need an additional 3,500 ophthalmologists. 3,500. We're only going to have about 500. So ophthalmology will, as far as market dynamics, ophthalmology will be forced more and more into the operating room.
Yes, I think that's what we're going to see. Yeah, but a lot of young ophthalmologists don't even want to be in the exam room anymore. They just want to be in the operating room, and they don't want that early glaucoma patient that is managed just by the prostaglandin. They want the advanced cases. And that's where optometry will shine.
And so that's perfect. So the market forces will put ophthalmology more and more in the operating room, and optometry needs to fill that void for all the chronic care, medical eye care, chronic care, and the acute care of the, whether it's a conjunctivitis or some type of keratitis or whatever it may be. Optometry needs to be positioned to do that. And again, the messaging that you have shared, the messaging that I try to deliver, is that optometrists need to prepare for that today, not 10 years from now. If you do that 10 years from now, you're way too late. You're out of luck. It needs to be done now. It's a great opportunity. There's never been a better time to practice optometry. I was giving a presentation Monday, just 5 days ago, to the third year class at New England College of Optometry. Every year I give them an entire presentation on the industry. And the messaging to them is this is the class of 2024, is there's never, ever, ever been a better time to come into the profession of optometry. The opportunities are phenomenal. You will always have the opportunity to have a 40-year professional career that's going to be fabulous. I mentioned, the net increase of optometrists each year. There are 1,800 to come out, 1,200 exits, so it's a net increase of 600. If you take a look at any of the career centers, Eyes on Eye Care, the AOA Excel, whatever, or ODs on Finance, there are over 1,800 open optometric positions to be filled at any given time. So it's just a great time. But again, we need to be prepared, and there's a lot of diagnostic equipment. There's a lot of technology that's available that will make optometry more and more efficient to be able to handle the increasing demand for both routine exams and medically oriented exams.
What is the greatest growth found in our industry? I know you mentioned medical model, but is there any other opportunities?
Well, there are obviously the niche markets. Myopia management is one. Concussion protocol, traumatic brain injury is another, and we don't ever want to forget about behavioral optometry, vision therapy. Those opportunities continue to exist, but without any doubt, I know I sound like a broken record, but over and over again, it's age-related medical eye care. That's where the growth is. That's where the opportunities are. And when we look at the population, the U.S. population, if you look at census data over the next 10, 20 years, the 0 to 18-year-old percent of the U.S. population is decreasing as a percent of the population. So it's still a practice modality, pediatric optometry and ophthalmology, a practice modality we need to continue to deliver on, but the growth isn't there as much as it would be in others. So again, 1.5 to 2% a year growth in the optical routine refractive side of the business, which is solid growth. We'll take it. And then that 3.5% per year growth in medical eye care. And we want to balance those out appropriately. And optometry can do both. Optometry can provide for both the routine refractive. I know a lot of practices, a lot of ODs out there that have really learned how to balance it well, have really learned how to delegate well. That's one thing. I hope it's changed from my training many years ago. We in optometry were never trained really well on delegating care, but we need to delegate as much as possible. The average optometrist needs to increase the number of patients they see per year, probably by 20%, and that can easily be done within the same physical plant, utilizing technicians and technology together.
Yeah. I talked to a lot of optometrists. The issue too is a lot of them have one exam lane. So they're still stuck in that 20-year-old model. Yep. They haven't, they were getting comfortable, and they need more, they need at least 2 lanes. They need a pre-test room. They need a scribe. They need a tech. They need the technology, and the staff needs to be educated on what needs to be done with patients, or what chief complaints, if they have issues, what testing needs to be done before they see the doctor too, just to be efficient. So there are some changes in the industry on that, and it really depends on the doctor that's really willing to change and adjust. And the ones that do adjust will be successful, will reap the benefits of, optometry now. And I think there is opportunity. I found opportunities in eye care, and it's not like it was 20 years ago, and it won't be the same in 20 years, but you have to continue to evolve and change. And one of the things that has changed a lot just in 10 years has been consolidation. What impact is consolidation having on our industry?
It's pretty interesting, because one of the possible solutions to the technology and the patient flow methodologies and the management of an eye care practice could be the management teams from the consolidators. So in consolidation, There's obviously, we've all heard private equity consolidation. There's been a lot of acquisition of eye care practices. Approximately 10%. I track every single acquisition that goes on. I keep it up to date, and we're at approximately 4,800 optometrists out of 48,000. So 10% are in a true private equity type play. In addition to that, there are thousands and thousands of optometrists that are in consolidation by publicly traded companies. So when I take a look at all of the optometric workforce, I would say about 22% is under some type of consolidation within the industry. I don't expect it to change too much beyond that, but it's been significant. And in ophthalmology, it's about 15% of all ophthalmologists are in a true private equity consolidation. And these are the Eye Care Partners, Kepler, My Eye Doctor, all of those types of organizations that have been doing a lot of consolidation. My hope is that these consolidators will, and I've shared the messaging with a number of them, they will see where the opportunities are. And while a lot of private equity players, their time frame is 3 to 5 years of looking at EBITDA or profitability, 3 to 5 years. But my hope is they'll look at where the opportunities are to grow organically, to grow the business, and see that growing the business in a consolidated play is growing medical eye care, and will help provide the docs and the staff the tools to grow that medical eye care. So consolidation, while a lot in the industry will say, "Oh my God, this is horrible. This is not a good thing," it actually could turn out to be a very positive force to help accommodate that increasing demand of age-related eye care. And we'll see how that plays out. But I think for any of the private equity consolidators that are looking out 3, 5 years, and maybe a little longer, we'll see that there's some great opportunities there by providing some management expertise to provide that technology, provide that patient flow expertise, kind of like a Six Sigma improvement within the running of a practice. But there is a lot of consolidation, and it's not a bad thing. It has also helped facilitate some greater vertical integration of optometry and ophthalmology together, because it gets beyond that political turf war of optometry versus ophthalmology and looks at it as one of the ideal ways of delivering care is put it all under one roof: optometry, ophthalmology, optical. And a lot of the consolidators, private equity players, have done that. They've done just that. So I see that as a positive thing. I don't see it taking over the entire eye care industry whatsoever. It's sort of like back in my early days in the 1980s, radio keratotomy was going to be the demise of eyeglasses, and the FTC rule is going to be the demise of optometric optical dispensing, and physician practice management companies in the 90s were going to destroy the industry. They're just it's just evolution of change. And one of the things I mentioned to the third year students the other day was that we always think, when we hear the term survival of the fittest, we always think of Darwin. And actually, it was a different biologist. It wasn't Darwin. Darwin was survival of those most able to adapt to change. And that's where we are. The survival of optometry will be those who are most adept at adapting to change. And the change is increasing patient flow to deliver more medical eye care while still delivering all the vision care services that we deliver today.
Yeah, thank you so much for your insights. I hope that the optometrists got some information out of this, and motivate them to go medical model, inspire them to make change, to continue to grow as optometrists, as doctors, as entrepreneurs. And thank you, Richard, for coming on the podcast. It's such
always
a pleasure always to have you on.
It's a pleasure. Thanks for having me. It's always nice to be had.